Hi, I'm Dr. Julie Steinauer. I want to talk today about a topic that comes up often here lately, a lot of regularity. We have phone calls and emails almost, I want to say nonstop about, can you work with someone who's monocular or someone who just has one eye? Now that can have a lot of different meanings. It may mean literally that someone has one eye and they might have a prosthetic for the other eye. Or it could mean that they only have one eye that's functional and it can see well. And maybe the opposite eye doesn't see very well at all. Maybe it's lost all but what we call light perception, where you shine a light into the eye and they can see that. Or there might even be a situation in which they see what we call hand motion, where they can't see the light, but they can see the motion of something moving in front of the eye. Now there can be tons of reasons why people lose the ability to see in one eye. It might be a sickness, something viral attacks the eye, the optic nerve, and causes them to not see very well. It could be an injury, could be a brain injury, it could be so many different things. But we can work with individuals who are monocular. And so what do we do? How on earth? Normally we're talking about things that are binocular or two-eyed, where we're training the brain how to use the two eyes together. But in the case of someone who's monocular, maybe they've just been forced into this where suddenly they've lost eyesight in one eye. And what we do is we train their brain to learn how to function properly with just the one eye that they have. And so it's retraining the brain how to assess depth. Although we can't train what's called stereopsis, because that's something that's measured with two eyes together, we can train cues to understand about depth better. And if someone goes from two-eyed down to one, the problem is they lose their depth perception or their stereopsis, and so their ability to tell how far apart things are or how far away something is from them just goes away in an instant. And so what do? It's very difficult even to go grab for a drink or something off of the table to feed yourself, because suddenly you have no depth to know where that's at. And for those of us who are two-eyed, it's kind of, we can't really wrap our minds around that. It also affects their peripheral vision. If they've suddenly gone down to being monocular again because of a prosthetic, maybe they had cancer and they lost the eye. Or there was an injury where they got shot in the eye or something like that, traumatic happened. And those instances do occur. But what we do is we want to train them how to gain and use their side vision or peripheral vision. Because one of the things that the brain does immediately is the brain becomes traumatized to going down to one eye, and it will actually restrict the visual field that they do have for their better seeing eye, or maybe their only eye. And so we have to tell the brain to kind of open that back up and don't tunnel vision down again. Open it back up. And in fact, we can train the brain to kind of gain a larger visual field than what's kind of considered almost humanly possible. But it's because the brain has a great ability to adapt. And then again, we train them how to process depth, even though they can't process it with two eyes. So there's so much that we can do. There's a lot of hope if someone that you know or yourself actually has gone down to having a problem with just being monocular. Then contact our office. You can call us at 618-288-1489. You can go to our website, visionforlifeworks.com, and fill out a questionnaire. That's kind of a first step with us. And you can gain more information that way. But I would really encourage you to call us at 618-288-1489. Now, if you happen to be a doctor or a therapist, just switching gears, check out our Next Level Vision Therapy group on Facebook. It's awesome. Thank you.